Okay.
Okay. All right.
Okay, so I'm Dr. Nicholas Peterson. I'm a pediatrician at OU Children's Hospital, spelled NICHOLASPETERSON.
Okay.
Okay.
So let's just start with the basics. What is Kawasaki disease?
So Kawasaki disease, another name for it is mucocutaneous lymph node syndrome. It's at this point still kind of poorly understood condition where it's inflammation in the blood vessels throughout the body. It can manifest in lots of different ways, but typically what you see is fever for at least 5 days, so kind of a prolonged fever course, followed by symptoms such as full body rash, redness of the eyes, swelling of the hands and feet, swelling of the tongue and dry, cracked lips, things like that. The reason that we worry about it is because it can lead to issues with the heart blood vessels, the coronary arteries. They can become inflamed and then dilate, and that can cause long-term issues. So that's why we worry about this condition, and we're very vigilant about trying to diagnose it.
Okay, so we're hearing about it hitting kind of en masse in like places like New York, which has obviously also been really hit hard by the COVID-19. Is there a relationship?
So it's still too early to tell, but there's been interesting data coming out the past couple weeks where they're seeing some kids that either are testing positive for active COVID-19 infection or they're positive for the antibodies that might indicate that they had been infected in the past. And a lot of those kids are presenting with a Kawasaki-like inflammatory syndrome. There's 50 plus cases that they've found in New York, and other parts of the world, the UK, Italy, Spain, places like that. So it's still too early to say definitely if there's a connection, but it's an interesting kind of trend that we're seeing so far, where the children aren't typically presenting with what you see with the adult side, where they're having more breathing problems, cough, respiratory distress, shortness of breath, things like that. These kids aren't really presenting with that. They're occasionally presenting more with this Kawasaki-like syndrome.
Is Kawasaki new like COVID, or Kawasaki's been around for a while?
It's been around at least several decades to my knowledge. Again, it's still being studied. We don't know what causes it specifically. There's a large school of thought that thinks there could potentially be a viral trigger, but we haven't actually found that yet. Despite years of research, we're still looking for it. So it's an interesting kind of conundrum we're in now, where is COVID maybe a potential trigger, or is it a completely kind of random correlation that we're seeing? That's why it's also interesting right now.
So we don't really know if it's infectious or contagious?
Kawasaki, no, we don't know if it's infectious or not. It is an inflammatory response that your body mounts to something, but we don't know what that something is yet.
So you said it's been seen around the world.
Mm-hmm.
Has Oklahoma seen cases?
Of Kawasaki disease? Yeah, absolutely.
Okay.
I've been in practice here at the Children's Hospital for just under 2 years, and I've seen probably at least a dozen cases just myself.
So what kind of research is there any research that you know of here that's been going on with it yet, or just
as far as the correlation between Kawasaki in general?
Yeah.
I'm not sure of any research our institution is doing. I know there's a lot going on, like in San Diego area. There's a Dr. Burns down there who's doing quite a bit of Kawasaki-specific research. I'm not sure if she has shifted any of her research to include this COVID-type things, but I personally am not aware of any specific research projects that are related to Kawasaki that have started here.
So is there anything that parents need to be diligent about to help with this, or?
Sure. I mean, they should just look out for the signs that we typically associate with Kawasaki, especially now if we think that it could potentially have a correlation with COVID-19. So the number of fever days, the cutoff that we typically give parents is 5 days. So if your child has a fever for 5 days in a row, that's when you should at least be calling your doctor, consulting with a doctor, especially if the fever is not explained by another infection that they know of. If they tested positive for strep throat or something like that, that's one thing. But if there's not a positive infection that you know of and your child has fever for that long, that's potential cause for concern. The other symptoms that I addressed before, like the redness of the eyes, swelling in the neck area, the hands and feet, full body rash. Sometimes you get dry, cracked lips. Sometimes your tongue gets real kind of swollen and looks like a strawberry. We call it strawberry tongue. That's a kind of a classic Kawasaki symptom. If you are seeing any of that in your child in conjunction with fever for 5 days or more, then that's definitely a reason to call your doctor. And then if they get very ill, dehydrated, lethargic, things like that, you should bring them straight to the emergency room for that.
So is this another reason that we need to be, as a community, as a society, more diligent in our right now, especially in our protective things like masking and all that?
Absolutely. I think we've shown good trends as far as all the mandated social distancing measures that we've taken throughout the country and throughout the state and even just the county here. I think we've shown good trends in it as far as our hospital numbers and things like that. It's been kind of understood or assumed since this all started that children didn't get typically very sick with it, and so I think the assumption was that they weren't necessarily a dangerous vector for spreading the disease, but now I think we're seeing that children are testing positive for it and they're presenting in a much different way. So that's even more reason to try to protect the children from potentially catching the virus, and then protect other at-risk populations, the older population, the immunocompromised, from any children that are showing any kind of symptoms like that.
And you're talking about COVID right now.
COVID-19, yes,
okay.
Correct.
And just random, was thinking, are there any, I know they don't know much about it, but is there any other kind of predisposition to that condition? Like if you had diabetes, you're more like
Kawasaki disease?
Yeah.
So it typically presents between 6 months and 6 years of age. That's kind of the more typical age range that we see. So once you get past that, into the school age, you don't see it nearly as much. It is more prevalent in boys than girls, but we do see it in girls. I've had plenty of female patients with Kawasaki disease. The younger you are, the more at risk of the complications, the heart complications we are, especially under 12 months. So if you have, an infant that's showing signs, it's definitely a reason to get checked out sooner than later. But it is, kind of that younger population. You don't really see it in teenagers very much. So definitely any parents with children in that age range should be vigilant about these symptoms.
Is there anything else you think of to add?
I will say, we are seeing this correlation throughout the country and throughout the world, and it's definitely even more reason to be vigilant about Kawasaki disease, but in the grand scheme of things, it's still fairly rare. And I think the numbers that I read this morning from New York are, they had 50 in the 50s as far as number of Kawasaki-like symptoms in possible COVID children out of about 4,000 that had tested positive for COVID-19. So really, this shouldn't be any cause for extra alarm or being, too paranoid about, if your child has a fever for a couple days and maybe a rash, it's probably just another different virus, things like that. It's more the constellation of things. It's more the prolonged fever for 5 days or more that should kind of sound some alarm in parents. So, and then just having discussions with your doctor if you have any concerns at all is always what we recommend. They, especially the pediatricians around here, I know are able to kind of talk through things on the phone with parents and give them guidance, whether they should come to the ER and get checked out, whether it's something they can reassure and kind of follow up in a couple days. Just always have that conversation.